just to introduce myself a little bit. So this is a collaborative study we've done with Dr. Nimishanth. Ironically, I'm based at Arsenal Football Club for the last 5 seasons, my 6th season now, and my involvement with women's cricket comes from the ECB as I work with the Middlesex and the London Spirit on a consultancy basis as a physiotherapist. Just to introduce Dr. Nimishanth.
Hello all, I'm Nimishanth and I'm a sports biomechanist. I'm currently positioned in Chennai, Sri Ramachandra with the Center of Sports Science. My major area of interest is cricket fast bowling, and now I'm starting to evolve an interest in injury prevalences and incidences as well. So back to Soni.
Right, so over the recent years, we've seen increased popularity in the women's game. However, we haven't seen that off the field yet because a lot of research is very male focused, but hopefully for the next few years and in upcoming conferences, this will be a change we'll get to see. Women's participation in cricket has been growing over the last few years. Anecdotal reports from India suggest that there have been over 300% increase in women's participation since the 2017 World Cup. And as we saw last year in the Commonwealth Games in Birmingham, the involvement of the T20 game from the women's side as well. But despite all of that, we've seen that when it comes to injury surveillance, we don't have much data available. There's been more research more recently, I think since the last conference in 2019 till today. But we've seen the injury surveillance mostly happening for over 3 decades, obviously led by Cricket Australia and the wonderful work of Dr. John Orchard, who I've literally grown up referencing in my university articles. Again, England, New Zealand cricket and South African cricket as well have published lots of research on injury surveillance. However, most of it is predominantly focused on the men's cricket. So as we can see, this is, again, all the research that we've grown up, obviously, reading. And we've got some great names, Dr. Akshay Mansingh with the West Indies cricket. The first ever research that came in 2005-06 with the methods of injury surveillance with injury definitions as well. And again, all of that was highly focused on the male sport within the thing. So obviously looking at the female athlete, it's hard to generalize the availability of the research on males and females because obviously, as we know, we as females are very different. What we can say is the physical differences, anatomical differences as well. I know in football we talk about the increased number of ACL injuries because of the Q angle. Also within the female population, the difference in sex hormones. Yesterday we heard a lot about the relative energy deficiency in sport correlating to the menstrual function. And Dr. Nimper, I think in 2019 research, she found that it was increased prevalence of lumbar stress fractures in batters, but there's more research needs to be done in this area as well. Also, in women's cricket, we found there's been increased number of lower limb injuries due to fluctuating levels of estrogen and relaxin as well, which can lead to laxity in the ligaments and predisposing them to sports as well. Apart from that, there's been a reduction in muscle distribution as well within the female population, with the upper limb shown they have 30% less muscle mass as well. All of this can affect the on-field performance, and hence, therefore, looking at the previous research, predominantly in males, it's hard to generalize that in the female population as well. And so again, this just reiterates what I have said. So the aims and objectives of our research was to investigate the incidence, nature, as well as the anatomical region and mechanisms of injuries sustained within the English elite female players and comparing it to the Indian state female players. It highlights the comprehensive need for understanding of injuries in women's cricketers, considering the physiological differences, match workloads, as well as the playing conditions. I'm going to hand it over to Dr. Nimishanth to talk more about our research.
So yeah, our methodologies are straight and simple. We had 18 English female cricketers and 12 Indian state female cricketers, and the data we collected was over a period of two seasons. That's from October 2020 to 2022. And the data collection module for the English side was using the Cricket Squad, which is a injury-specific data collection module that's been a platform that's been used by the ECB. And for the Indian side, it's the self-assessment injury forms. To ensure standardization and consistent data analysis, we followed the 2016 consensus on integrated injury definitions, which allowed us to categorize injuries as medical attention injuries, which includes both time loss and non-time loss injuries. These, to ensure the consistency in the classification as well, we use the O610 coding system. So the injuries were then graded on the basis of the total number of days that the player was made unavailable for playing. So going on to the results, our results were quite contrasting, so I couldn't put it in a nutshell, so it's going to be a bit elaborate. The study revealed that the English female cricket players experienced a total of 95 medical attention injuries with a significant 85.7% of players reporting more than one injury during the period of examination. We analyzed the nature of these injuries, and an interesting trend emerged. Of all the medical attention injuries, the English players had 56% of time loss injuries, indicating the severity and recovery time associated with these incidents, and on the other hand, 42.2% were non-time loss injuries. Furthermore, the data also shows about 34% of injuries among English female cricket players were sustained during matches, and the remaining occurred during training. So this underscores the need for specific injury prevention strategies for both competitive play and even during practice sessions. Turning out to India, we found a stark contrast. The Indian female athlete players only reported about 16 injuries during the study period, surprisingly, of which about 58% of these injuries were time loss injuries, which was also suggesting that when injuries do occur in our side, they tend to be more severe in nature. While on it, we also calculated the match injury incidences for the English. We found out that the total injury incidence was about 169 injuries per 10,000 hours of play, and the incidence rate was way large with the T20 matches on comparison with the one days. But unfortunately, we couldn't do the same for the Indian players, as we didn't have a strong data structure. The data we got or obtained was very approximate and unreliable, as there was no proper records. So getting back to the sites of injury, we have classified them on 3 bases. One's the anatomical site, the other one's the nature of injury, if it was muscle injury, bone injury, or both. Mechanism of injury as well, like if it was during batting, bowling, or running, catching, etc. Surprisingly, with the English women's cricket, wrist and hand injuries were very common, accounting for about 19% of the medical attention injuries, and following them was thigh injuries, shoulder injuries, and lumbar spine injuries. But with the Indian female players, it was a bit different. Knee injuries and hand and wrist injuries were notably prevalent. Approximately 33% of the players of the Indian population sustained them. The prevalence of hand and wrist injuries was quite similar between the English and the Indians, but the knee injuries were a distinctive feature of injury in the Indian profiles. This discrepancy also suggests a variation in playing techniques and physical conditioning between two groups, underscoring a need for tailored injury prevention strategies. Additionally, it was also essential to highlight the particular vulnerability of the fast bowlers. In the study, we had 5 English fast bowlers all of them who developed lumbar spine injuries, and also of the 13 thigh injuries, about 9 of those, which is a substantial amount of 69.2%, were hamstring injuries. So yeah, it's also nice to focus on the hamstring. Final results page, I promise. We also delved into the positional differences within the sport. Among the English players, it was the bowlers who had the majority of injuries, accounting for about 44.2% of the medical attention injuries. In contrast to the Indian batters, experienced the highest injury rate. The disparities highlight the unique physical demands and risk associated with different roles in the cricket as well. Muscle injuries were found to be most common amongst the both, representing 44.2% amongst the English and about 66.7% among the Indians. Another notable aspect is the onset of injuries. Majority of both England and the Indian female players had an insidious onset. Gradual onset was also on a point, and was often associated with activities such as bowling, running, throwing, and weight training. When we examined injury severity, the study found out that 31% of the injuries recorded were considered serious, with recovery times ranging from 29 days to 6 months, And additionally, 25% were classified as long-term injuries, which means they've been requiring over 6 months period time for recovery. By the way, the injury severity was calculated only for the English and not for the Indian population due to the data scrutiny. Going on to the discussion. One key observation is the contrast in injury incidence between the two populations. The study showed a higher injury incidence of knee injuries among the Indian female cricket players, while English female players experienced a higher incidence on hand and wrist injury. But contrastingly, earlier studies have also depicted shoulder injuries to be of a more common site of injury. This discrepancy also states the importance of injury prevention strategies tailored to unique demands of each playing population. Despite well-established literature evidences of the relationship between low back pain in men and the bowling and fast bowling, this study conveyed otherwise. This might be attributed to the fact that the training load and training volume are a bit adjusted in terms of men versus women population. And also a significant concern arose when we analyzed the data further. Approximately 25% of the injuries of the Indian data set were reported as recurrent injuries, which means that some players might have had experienced multiple injuries over the same study period. Additionally, about 33% of the Indian population was marked data not unavailable, suggesting gaps in data collection and reporting. It's crucial to recognize that the lower number of injuries reported in the Indian data set may not reflect the lower injury risk of Indian female cricketers. Instead, it can also highlight the importance of robust data collection methods and injury reporting systems in the Indian cricket domain. It's entirely possible that injuries are being underreported or not adequately documented. Moreover, the study pointed out that many data sources, including hours of practice and the match hours, were unscrutinized. This lack of detail can hinder a comprehensive understanding of the injury patterns and risk factors in Indian female cricketers. Back to Soni now.
So to finish, wrap things up, so the main future implications, as we now know, there's big data discrepancy between the English and the Indian side. Just in a nutshell, in the ECB, we collect injuries over a cricket squad. Ben's obviously been one of my colleagues as well. So we've done that for many, many years. However, when it came to India, the challenges were they didn't have any robust records. We had to collect injuries from a self-reported forms. And as this was a retrospective study of the last 2 years, you can imagine the difficulty in obtaining data from the Indian side. Again, future ideas can also lead to more collaborative research. Again, I've spoken to colleagues from South Africa, Australia. It'd be nice to sort of have more collaborative research, how we've done with the English and the Indians, to compare the differences as well. Moreover, again, we're just scraping the tip of the iceberg when it comes to women's cricket. We don't have much research on women's workloads, and the men's, we know the spike of workloads can lead to injuries as well. Again, we need to look at research on biomechanical analysis. It would be nice if Dr. Fernandez could maybe assess a couple of women bowling techniques to look at any further injury risk factors as well. And again, talking about the different hormonal differences, and again, further research is also equated to see if the relative energy deficiency in sports somehow has an effect on the performance as well. And just to wrap things up, so obviously injury surveillance is very fundamental for injury prevention as well. The focus needs to be on specific injuries, like our research found a high number of hand and wrist injuries. And from my perspective, obviously working with Middlesex, a lot of them were injured fielders due to contact injuries while fielding. And again, injury prevention, as we all know, is fundamental for the longevity of a cricketer. Thank you so much for this opportunity.